It strikes without warning, a sudden, sharp agony tearing through your lower back or abdomen, intense enough to drop you to the floor. The pain is followed by immediate, alarming complications. You may feel a severe burning sensation during urination or see the visible presence of blood in the toilet. As the condition progresses, the entire body reacts. You may experience extreme nausea, vomiting, a relentless urge to urinate, and a fever, a clear sign of an internal infection. This physical crisis is the final stage of a silent biological process that has been building inside the body for months. The culprit, a kidney stone, forms in complete secrecy. It develops and grows while triggering no symptoms at all, remaining undetected until it is fully formed. To understand the source of this pain, we must look at the body's chemistry. We must investigate how harmless fluids transform into a jagged, solid rock. That investigation begins at the primary filtration center of the body. The kidneys act as a continuous filtration system. They process fluids to remove waste and maintain the body's internal balance. This system requires a constant supply of water to function. When daily intake drops too low, the filtration process begins to fail. Insufficient water causes the urine to become highly concentrated. It thickens, losing the fluid volume required to keep waste products in a liquid state. This dehydration shifts the environment inside the kidney. A flowing, efficient system of waste removal turns into a stagnant pool where minerals can settle. This diagram shows the microscopic waste materials trapped in that thick fluid: calcium, oxalate, and uric acid. Without enough water to keep them dissolved, these particles are forced to collide. They begin to chemically bind, locking into sharp, jagged microcrystals. These crystals act as a foundation. More particles layer onto them over time, slowly building from a microscopic speck into a solid, hard mass. The body has now manufactured its own internal physical hazard because it lacked the biological solvent, water, needed to keep these minerals in check. Everyday habits can speed up this construction. High levels of salt and a reliance on junk food artificially increase the concentration of minerals in the urine, providing raw material for stones. Certain healthy foods also carry hitting risks. Spinach and beetroot contain exceptionally high levels of oxalates, which can trigger stone formation if eaten in excess. Other factors act as risk multipliers. Clinical obesity and a family history of stones make the kidneys more susceptible to these dietary triggers. A stone forms as the predictable result of high-risk dietary inputs, chronic hydration deficits, and genetic multipliers. The agony begins when the fully formed, jagged stone finally moves. It leaves the kidney and attempts to travel out of the body. As the stone enters the narrow ureter tube, it hits a bottleneck. The stone wedges itself inside, stretching the sensitive tissue and physically blocking the flow of fluid. This mechanical blockage causes the internal pressure to build, resulting in the excruciating pain and internal bleeding seen at the start of the process. For smaller stones, the primary solution is a natural flush. By increasing fluid intake, you create internal pressure needed to move the blockage through the system. This requires a specific volume, drinking 2.5 to 3 liters of water every day to dilute the urine and force the stone out. Larger stones that cannot pass naturally require immediate medical intervention. Doctors use specialized medication to relax the urinary tract or procedures to break the stone apart. Aggressive hydration serves as the primary tool for both physically flushing current stones and diluting the minerals that lead to future ones. Traditional ayurvedic medicine focuses on long-term prevention, using specific botanical compounds to strengthen the urinary system and prevent stones from forming in the first place. This illustration shows punarnava, gokshura, varuna bark, and pashan bed, herbs traditionally used because they act as natural diuretics to increase urine flow and contain compounds that help inhibit binding of calcium crystals. Because individual chemistry varies, these Ayurvedic remedies should only be used under the guidance of a qualified practitioner to ensure the treatment is appropriate for your specific case. Prevention requires a lifestyle commitment. Reduce salt, limit sugary drinks, Maintain a balanced diet and prioritize consistent hydration. Kidney stones are a preventable crisis. They are managed through a combination of daily hydration, dietary awareness, and integrated medical knowledge.